Hi, Dr. Yass here. In this video, I'm going to talk about pain or altered sensation that begins at the elbow and then extends down to the wrist, the hand, the fingers. I want to talk about what the etiology or the cause is. So someone just contacted me and they're talking about having some altered sensation that they have been told is associated with the ulnar nerve, and since the ulnar nerve passes through the gap between the elbow bone, the olecranon process, and the medial epicondyle, which is a bone at the inside end, bottom end of the upper arm bone, there's a little groove that forms there and the ulnar nerve runs through there. And this individual is being told that the cause of their symptoms is some sort of compression or something occurring with the nerve as it passes through that groove. So you have to say to yourself, if you have any sense of logic, well, that groove exists. What would make the groove become altered in a way that it would cause some sort of impingement of that nerve? So the answer is, well, if I took a hammer and I beat in a portion of the outside wall, one of those two bones, maybe it would collapse the groove and maybe then there'd be some sort of compression, or maybe you magically develop some massive level of excessive bone development in the groove which was now compressing on it. But barring those two things, what would cause any irritation of the nerve as it passes through the groove? Nothing. But if you go to a person in the medical establishment who has only been trained that variations or symptoms associated with the ulnar nerve relate to this point where the nerve runs through the groove, that's your only solution that you're given. And by the way, the answer to that is moving or transplanting the nerve outside of the groove. That's the surgery that would be performed if that was what you were told is the cause of your symptoms. It's just complete idiocy. It's absolute insanity. But what you are not understanding is that when you go to the surgeon, that's all they know. That is the only possible diagnosis they can give you if you have altered sensation, which is associated with the ulnar nerve, which is altered sensation at the ring finger and pinky, all around those two fingers. So just wrap your head around when someone tells you that. You have to recognize that you got the answer that you went there to get. You have altered sensation at the pinky and the ring finger. You have some variation or irritation of the ulnar nerve. As far as they're concerned, that's the only place it can happen, and the only solution is to transplant the nerve outside the groove. What you have to also know is the fact that there's a higher probability that that nerve passes through this group of muscles right here, your forearm muscles, which relate to wrist flexion and closing of the fingers, finger flexion. And the nerve doesn't run through a tunnel, it actually goes directly through the muscle. So if the muscle were to strain, it could impinge on the nerve. And therefore, by impinging on the nerve, create the hypersensitivity, creating the symptoms in those two fingers. Which do you think sounds more logical? That somehow there was some effect on this tunnel that the nerve passes through at the elbow, or that you may have strained your muscles enough to cause them to thicken and impinge on the nerve? Especially when you notice that the symptoms are enhanced by the fact that you're doing a lot of stuff with your hands and your forearms. You got to get smarter. You got to look to alternate sources of information other than the medical system, because the medical establishment is trained in a specific way, and they only have that way, and they're never going to deviate from that way. You have to get smarter. By providing these types of videos to you, I'm giving you an alternative source of information based much more on logic. So if you want to take it one step further, why did you strain your forearm muscles? The answer is because your hand is designed to grab objects and manipulate them, not to support the weight of them. The support of the weight of your arm and the objects you grab comes from the shoulder and shoulder blade muscles. Because the upper arm is attached to the shoulder blade eventually has to be supported to the axial skeleton, which is your rib cage. Those muscles support the shoulder blade, your arm, and any object you support. So it turns out that if you have weakness of your shoulder and shoulder blade musculature, it's going to lead to these forearm muscles not just grabbing and manipulating the object, but trying to support the object. You're going to squeeze it tighter. You're going to strain those muscles. They could then impinge on the ulnar nerve as they pass through, and there's your symptoms. Shockingly, the cause of your symptoms, which is some altered sensation at the ring finger and pinky, is some weakness of the shoulder and shoulder blade muscles. But it makes sense. It's logical. Is it part of the medical establishment understanding? Of course not. You have to recognize there can be things that are different, especially when you look at what they're saying, the failure rates of their treatments based on their understanding. It's false. It's fake. It doesn't work. That's why I'm doing this. People constantly keep asking me, why are you making these videos? You don't get paid to make these videos. The answer is because I am much more an educator than I will ever be a practitioner. I know. I have figured out over a quarter of a century what is causing pain, and it is my responsibility, both ethically and morally, to provide this information to stop that person, just like the person who emailed me, from getting that psychotic surgery, which I basically can guarantee you has a 0% failure rate, a 0% success rate, 100% failure rate. Okay? So if this is making sense to you, and you're wondering now, wow, should I go along with that surgery, or should I try this guy who's saying he just needs to do some exercises to make my altered sensation, which is associated with my ulnar nerve, go away? You got to get smarter. This is your chance. If you like this video, please give it a thumbs up. If you like these types of videos I'm putting on my YouTube channel, Dr. Mitchell Yass, please subscribe. It will allow you to get notifications when new videos just like this one are added, or when I'm live on YouTube, which I just was a little while ago. If you want to get in touch with me, you're not sure about the types of symptoms you're having, and you want to clarify them with someone who's actually logical and has a wider understanding than the medical system, you can contact me at my email address, drmitch@mitchellyass.com, DRMITCH at mitchellyass.com, drmitch@mitchellyass.com. If you've decided that you feel that you'd like to move forward and you'd like to get a Zoom or Skype session so that I can help you diagnose the cause of your symptoms, and if it is confirmed to be muscular, which I've proven in more than 98% of cases, well, we'll confirm it, and then we'll give you a series of exercises, and you'll be on your way, and you'll get pain-free and fully functional. You can call me or contact me, again, to make that Zoom or Skype session by email at drmitch@mitchellyass.com. All right, folks, more information coming. Hopefully you're getting it. My response has been fantastic. The thumbs up are great. The number of subscribers is improving. We are making headway. We are expanding awareness. A little understanding, I just got 2 people to like me on Facebook who are from a country called Cebu. I tried to figure out where it was. Turns out it's in the Philippines. Little old me doing these little videos are working. I'm reaching out to the world. I just made another appointment for a Zoom session for a woman in Australia. We are making headway. We are breaking down the walls of the medical establishment so people can break out, get the information they need, and get to become pain-free and fully functional. That's my goal. That's what I think I've been chosen to do. All right? For now, Dr. Mitchell Yass wishing you a pain-free, fully functional life. Bye-bye for now.